I've been receiving treatment from West LA Medical for about a year, and I can't even tell you how much it's changed my life. When out of nowhere, I started to get back pain, and that spread to my legs and my arms as well as my chest, and it left me completely bedridden. I couldn't walk. Sleeping was excruciating. Just every activity that I was used to, not able to do anymore. I'd be lying if I said I wasn't skeptical at the start of my treatment program. I had been to a lot of other doctors and hadn't had any relief, so who's to say Dr. Britton would be any different? I was later diagnosed with lupus and Sjogren's syndrome, and as a result developed peripheral neuropathy.
Today, we're talking about one of our patients, Alyssa. Alyssa came in after she had a diagnosis years ago of both multiple sclerosis, which then led to a lupus diagnosis, and both of those being an autoimmune condition.
I had been to a lot of other doctors and hadn't had any relief, so who's to say Dr. Britton would be any different? But there were a couple of things that stood out with him. First was my MRIs. He was one of the first doctors to actually pay attention to my MRIs as opposed to just kind of glance them over and move on to the next. He was able to show me that indeed there were some mechanical issues going on with my neck and my back that other doctors hadn't noticed prior.
When we end up examining her, I didn't go for curing lupus or curing MS. What I looked for is how could I improve the quality of this woman's life no matter what's happening with her immune system.
He wasn't like other doctors that had given me these grandiose promises of you're gonna be 100% and I'm the one that's gonna fix you. He had this humility about him that was refreshing of I care and I want to get you to that place. I'm gonna do my best and let's see where we go.
For any type of healing, at least 3 basic organic things are necessary: oxygen, fuel, and activation. The way some of her treatments that she'd gotten previously were missing is they were doing oxygen here, so they were attending to it, but they weren't getting to the activation. Or they do something like physical therapy, get activation, but no fuel and no oxygen.
Just through different types of therapies, we continued to do decompression, we did stretches, we did laser and pulse, and oxygen while she was on pulse. Eventually, most of the pain going down the legs disappeared.
We also had to target a lot of her muscular problems in her neck. So with that, me and Doc mostly worked on her myofascial work, which is just simple massage therapy in order to release some tension going on within those tight muscle groups in her neck. When someone gets some heat, a little bit of massage, break up that tissue, the decompression machine is able to pull a lot more aggressively, but in a safe way, so that way they feel the max amount of pressure being applied to their neck without them straining or spasming in that aspect.
We've done laser with her, which she sometimes has inflammation, and that helps it go down. And the pulse also helps with those muscles not to contract as much and for her to be able to kind of get that blood flow that she needs.
We did laser and pulse and oxygen while she was on pulse. Eventually, most of the pain going down the legs disappeared, and the lingering symptoms were mostly the headaches. Doing trigger point injections in the occipital lobe, we actually helped bring the migraines down, and now they happen every so often, but not as much as what she came in with initially.
I want to be clear, what we're doing is not surgery. In surgery, you don't have room for trying things. In this, we had the opportunity to look at her functional reactions so we could make a treatment plan based on her. And then finally, we attended to the orthopedics. The last piece was getting her neck stabilized, getting her neck curved back, but that was the very last. And we had some tremendous results, and quite honestly, I've treated a few hundred patients with these conditions where it falls back and forth because some autoimmune conditions are subjective, meaning depending on what sets that person off, sets them off.
To start, you've got Dr. Britton, who's brilliant and funny and warm, and the aides, every single one of them are just lovely people. Unlike any other medical facility I've been to, literally every single one of these people truly care about their patients and seeing them improve.
She's just a great patient because she follows everything to the tea for what we tell her to do.
Somebody tells me they have a neck ache, I say, go to Dr. Britton. Somebody tells me their knee hurts, I say, go to Dr. Britton. I absolutely owe my life to the staff at West LA Medical, and I'm internally grateful that I got the opportunity to work with them.